China is seeing surging cases of mycoplasma pneumonia, with the Education Ministry advising sick teachers and students not to go to school. In South Korea, concerns are growing, prompting pharmaceutical firms to increase production. Kun-woo has the details.
The recent spread of respiratory diseases in South Korea and globally has increased concerns domestically. The illnesses include both flu in South Korea and a recent surge of mycoplasma pneumonia, especially among children in China. In response, pharmaceutical companies have been increasing production of medicine, including fever reducers and antibiotics, to cope with the rising demand. According to one drug maker, production of antibiotics jumped 20% on year, while production of cough expectorants rose 15%. And those production figures are rising as the Korea Disease Control and Prevention Agency reported that around 46 out of 1,000 visitors to outpatient clinics had symptoms of flu during the fourth week of November, 7 times more than expected in a flu season. In China, the Education Ministry issued a notice on preventing and controlling winter epidemic diseases in schools, despite doctors in the country saying the disease is not new and comparatively mild, occurring roughly every 4 years. It has ordered students absent from school to be monitored, personal hygiene regimes to be strengthened, and also requested the stockpiling of masks. This is the first warning issued by the Chinese government related to the spread of respiratory diseases since its zero-COVID policy last year. Meanwhile, specialists say China's recent spike in respiratory illnesses is because it's the first full winter season since strict COVID-19 restrictions were lifted in December 2022. They also said resistance to antibiotics used to treat the disease in children may be one of the reasons for the increase. Elsewhere, officials in Denmark and France say mycoplasma pneumonia is now being considered an epidemic, despite the World Health Organization saying it is not a reportable disease to the WHO and appears to be in decline. Kun-woo, Arirang News.